This is a plain CT scan of face and paranasal sinuses of a 68 years old female patient. She is diabetic and a known case of mucormycosis. Ill-defined erosions are present involving superior alveolar arch, both maxillary bones, both pterygoid bones and their plates. Please observe these ill-defined erosions involving all the walls of the maxillary sinuses. On right side, right zygomatic bone is also eroded. Anterior part of right zygomatic arch is also eroded. Left zygomatic bone and left zygomatic arch, these are normal. Erosive process extends upwards to involve both the nasal bones and the visible parts of the frontal bone. I go back. All the walls of the frontal sinuses are eroded. Mucosal thickenings are seen in all of the paranasal sinuses. These are suggestive of pansinusitis. Now the erosive process has involved body and both the greater and lesser wings of sphenoid bone. Here, this one. This is the region of clivus. Erosive process has involved clivus and the middle parts of petrous parts of both the temporal bones. Both anterior clinoid processes are eroded. This is dorsum sali, and the posterior clinoid processes is also eroded. This is the soft tissue window. Patient has developed ptosis on right side. Now please observe, this is a soft tissue mass which lies in the supromedial part of right orbit. This one here. Adjacent bone is normal. Lamina papyracea is intact. Posteriorly, it extends up to the orbital apex. In this region, it has partly surrounded the right optic nerve. Its interfaces with the medial rectus and superior rectus muscles are indistinct. I will show you further details on the axial scans. This is the coronal scan. Please observe the extent and severity of the bone erosions involving all of the visible bones, that is the frontal bones, superior alveolar arch, hard palate, maxillary bones. This is the right zygomatic bone which is eroded, and this is the soft tissue mass which lies in the supromedial part of right orbit. It shows intracondylar extension and comes to lie against this is the optic nerve here. I wish a contrast CT scan was done for better visualization. It extends posteriorly up to the orbital apex. Here it has partly surrounded the optic nerve. There is no intracranial extension. Now this is the erosive process which has involved the body and these are the greater wings of sphenoid. This is the sagittal scan. Now please observe the erosive process involving the clivus, posterior clinoid processes, dorsum sali, and petrous parts of both the temporal bones. It is an extensive involvement by the mucormycosis mucormycosis. If all of the bones were involved, then the likelihoods of multiple myeloma would have been in the differential diagnosis. Focal areas of bone erosions are more suggestive of the metastatic lanes, but this is a bone erosions which are almost in continuity with each other. Please observe, this is the hard palate here. So it is an infective process. And furthermore, patient is a known case of mucormycosis.